Hi everybody and welcome back to the channel, and this week's learning is about statins and muscle pain and 3 takeaway messages you can give to your patients. So this is not a presentation on whether patients should be taking statins or whether they work or not. I'm not a medic, I'm not a prescriber, and that is not within my scope of practice. This is addressing a common problem where a patient with muscle pain will come to my MSK clinic and say, I wonder if my pain is due to the statin I'm taking, and then starts asking for my opinion. Now, this presentation is based on the meta-analysis in 2022 in the Lancet, which analyzed data from over 150,000 patients. So let's have a little look at the data from the Lancet. So when you look at the forest plot, the media only focus on the statin group. So 27.1% of people taking statins reported muscle aches and or weakness. But if you look right across the line at the control group, 26.6% of people taking a completely empty sugar pill will report the exact same thing. So this means that the drug itself is only responsible for a tiny 0.5 absolute increase in risk. So if we were to visualize 1,000 patients, 995 of them will have the same experience, whether they're not due to the statins. So the really important thing though is the dose does appear to matter. So if a patient is taking a low moderate dose, 20 to 40 mg, then 5 out of 1,000 patients experience statin-induced pain. If this number increases to over sort of a higher level, so 80 milligrams, then that increases to 13 out of 1,000. So a standard dose, the risk is incredibly low, but it does start to increase if we're taking higher dosages. But the risk is strictly dose dependent. So the other thing that really matters though is the timing. So this part is really reassuring for patients, because if you look at the forest plot, then we can see that the data points only lean towards an increased risk in the first 3 to 6 months. So this appears to be the critical window. If the drug is going to cause muscle aches, it generally does it quite early. Whereas if you're looking at years 2, 3, 4, the data drops really, really low, and the risk is completely flat compared to placebo. So the takeaway is clear. The risk doesn't hang over your head forever. If you tolerated your statin for over a year, any brand new aches and pains you develop are highly unlikely to be due to statins. More likely it's due to just normal musculoskeletal life. So take home messages. And these are the 3 things I tell my patients. So 1, the risk of muscle ache with statins is really, really low. And it's about, on a normal standard it's almost like standard dose. It's the clinical risk is 1 in 200, so the number needed to harm is 200, so it's 1 in 200 would develop muscle pain. This 2 is it seems to be dose dependent, so if you're on a lower dose, the risks are lower. And 3, it is affected by the timing. So if your pain starts a year or 2 years after taking statins, it's highly unlikely to be due to the statins. So I hope you found that very brief take-home message and teaching useful. And if you have, please like and subscribe, and I will see you next time.